Biswajit sir.
The next presentation will be from Sathya Sai Seva organization Odisha. That is effectiveness of hospital information system, integrated teleconsultation helping during the COVID pandemic, implementation and clinical impact from a volunteer organization's perspective. I think Satya Swaroop Patnaik and team, they are going to present. They can start now. Who is presenting it? Satya Swaroop?
Yes, sir.
Yeah.
Am I audible, sir?
Yeah.
My screen is shared. Yes, sir. Good morning, everyone. I am Dr. Satya Swaroop Patnaik, representing Sri Sathya Sai Seva Organizations India. And today I'll be presenting a paper on the effectiveness of HIS integrated teleconsultation helpline during the COVID pandemic. We are a large volunteer organization. We do a wide gamut of medical activities through a network of volunteers. Mainly, we have these healthcare centers in many of our Sai centers, which cater to the primary treatment of the patients. And wherever required, the patients are referred to government facilities or other hospitals and Sathya Sai hospitals. But due to the pandemic, we could not cater to these patients, some of who were very chronic patients and on a long-term follow-up. We had our team of volunteer doctors and volunteer healthcare workers. All we required was a platform which was provided to us with the help of this Exotel and Health for All platform, which I'll be describing later. And with this telephone-based helpline, we could provide relief to the patients. We launched our first helpline in Odisha as immediately after the national lockdown, and slowly we have progressed step by step from there. The salient features of our helpline being that we have attempted to provide high-quality healthcare services free of charge to the patient. Our main aim was to reduce hospital visit for non-COVID patients wherever feasible, because the entire government machinery was concentrating on the COVID patients. So we wanted to pitch in and complement the efforts of the government by supporting the non-COVID patients and reducing their hospital visits. We had doctors from multiple specialties available on a single helpline number, where the interface was actually the volunteer, many times our volunteers would go the last mile to dispatch the medicines and ensure local follow-up to the nearest hospital wherever needed. We did attempt to reach out to the rural population through our network of volunteers. A brief schema of our outflow. So the patients call in on this single helpline number, which is answered by the volunteer. The volunteer updates the notes on the HIS and then searches for the patient details, whether it's an old patient or a new patient. In either case, the registration is done. The consultation request is raised to the doctor. The appointment is fixed. And once the appointment is fixed, an appointment is created and the patient is informed. And the patient and doctor are connected at the appointed time. After the consultation, the doctor enters the clinical notes, and this consultation summary is generated. It's updated on the system, and this is sent to the patient via SMS link, to which the patient gets a link to download the consultation summary. This SMS link is also used to receive the reports from the patients before the consultation. This is a brief schema of our workflow. The technical architecture for this is a cloud-based telephony solution provided by Exotel for receiving and making the calls. All these calls are recorded for quality review and reference. Health for All is a free open source health information system from UCDS, and this is being used for patient registration, appointments, consultant notes, and related clinical workflow coordination. And this Health for All HIS is integrated with the cloud telephony solution. As a part of the registration, all the patients receive an SMS with an embedded link via which they're able to upload their previous reports and prescriptions, if any. And the patient demographics and their prior medical records are pulled into the Health for All HIS application, and they are saved ahead of the consultation with the doctor. And these documents are linked to the patient digital record automatically, and whenever the doctor accesses the data, he can go through these reports. Access to patient data is restricted by a role-based unique user login and application privileges. And at the end of the consultation, a summary is generated and sent to the patient. The sample SMS and a sample discharge summary, which is in a PDF form and can be downloaded, and which is in compliance with the telemedicine practice guidelines. We have made a lot of effort to adhere to the telemedicine practice guidelines by conducting orientation webinars for the doctors who provide the consultations, training the doctors individually. We had some very excellent videos which were shared. So we ensured that our doctors went through the videos and the documentation regarding the guidelines and the updates. We took efforts to train our volunteers who perform the role of the interface with the patients, and all the volunteers signed a NDA to maintain privacy and confidentiality of the patient information. All the calls have been recorded for audit purpose. We do a review of the calls and consultation summary by our quality control team. The e-prescriptions which are sent to the patients also are in compliance with the guidelines. And we do have regular review meetings with our doctors and volunteer team to see our position. Again, in compliance with the guidelines, we established the identity of the patient and the doctor at multiple stages. The medicines prescribed are as mandated or as permitted by the guidelines, and the list of the medicines are shared with the doctors as a part of the onboarding and training process itself. We have a drop-down menu where the list of medicines are available in generic form, and it once selected, it automatically reflects in the consultation summary. Consent in this case is implied consent as the patient calls in, and we maintain the digital trial and documentation by recording the calls and the consultation notes. Quick look at our statistics. So far, we have served 5,688 patients with a team of 115 doctors and 157 volunteers. Since we started in the states of Odisha, Kerala, and then Telangana, a large chunk of our patients are from these three states. But we have also received calls from other 17 states of our country. If we see the month-wise flow of the calls, it has peaked during the peak of the COVID. So this effort to reduce the hospital visits has helped. Department-wise, we cover a lot of departments ranging from cardiology to medical gastroenterology, nephrology, pulmonology. Most of our calls are for general medicine patients. We have a few interesting, we call them the inspiring cases, because these are the cases which inspire us to keep this service going ahead. And there was a 70-year-old patient from one of the interior villages of Dhenkanal district of Odisha who was complaining of head reeling and episodes of fainting. And this patient's children were far away. This was during the peak lockdown. He called to our helpline. We requested him to get a ECG done, which he could get done. Our cardiologist asked for ECG, and it showed a heart block. And this patient required a pacemaker implantation. But his children were not in a position to come down. No one in the family was there. So our cardiologist prescribed some medicines, and within 2 days, the medicines were delivered by our volunteer team. Within 2 days, the patient drastically improved. And subsequently, he was followed up with the local cardiologist, and the required procedure was done. Similarly, a 70-year-old diabetic patient from Bhadrak, who has been coming to our camp for the past 10 years and taking her share medicines from us, monthly medicines from us. For 3 months, 2 to 3 months of the pandemic, she could not take her medicines because she could not come to the camp was closed, and she could not get the medicines in her village. In fact, I was present during this camp when we had a virtual health camp, and we thought it's a very routine camp. But the patient, on seeing her doctor who has been treating her for the past 10 years, she was in tears. And of course, the consultation was done, and we ensured that the medicines reached her via speed post. So we have a lot of cases like this. I would not go through due to the lack of time. But just to conclude, that this is a volunteer-driven initiative, a small effort from us to provide this service, quality service free of charge to the patient. Since it's cloud-based telephony, it's scalable and adaptive, and it's not just a telephone call. It is integrated with the hospital information system, with the HIS, and that takes care of the clinical documentation and the medical records. It is an inclusive service, meaning that it is accessible to a patient even with a simple feature phone. And we have tried our best to ensure last mile delivery by integrating services like in-person consults, medicine dispatch, follow-up calls, and wherever required, video consultations based on the clinical need. We have made our maximum effort to adhere to the telemedicine practice guidelines and focus on quality of the consultation, maintaining high standards of care, and ensuring that the patient as well as the physician are satisfied. And we do have scope for improvement, and post the pandemic, or even now, we are looking for scope to innovate, expand, and improve, to have systems wherein we are using the system to give appointments for our OPDs and clinics, so that again, patients who are coming in can stick to the COVID guidelines and we can avoid overcrowding. So this is a small effort in this pandemic to support the efforts of the government and the many institutions which are going ahead with this telemedicine practice. I hope this service of ours has been of help to society. Thank you. Thank you once again.
Excellent presentation, Patnaik ji, and you have done a phenomenal work, and your presentation was also very lucid. From chat box, we have not found any questions. Mahapatra ji, any questions?
I think he has explained everything. He did they are doing, because I'm from Odisha, I know they're doing a wonderful job. I think based at Bhubaneswar only. And I think they will be doing more and more things. So let us go to the next.